Throughout the pandemic, Dr. Mallika Marshall has been answering your questions about COVID-19 and the vaccines. Today, why so many people are still dying from the virus and why you shouldn't wait to get your shots. Dr. Mallika is here with the answers, as always. And Mallika, Amy wants to know, since no real studies have been done, nor appear to be planned, on the efficacy of the vaccines on immunosuppressed people, are those people, she says, in parentheses, me, going to have to wear our masks for the rest of our lives when we're outside and around other people we don't know?
You know, this situation must be incredibly frustrating for the nearly 10 million people who have weakened immune systems here in this country. In some cases, doctors are suggesting that patients alter their drug regimen around the time of vaccination to try to give their immune system an extra boost to mount a response, but that's not possible for everyone. It's possible that booster shots will be recommended for these people, but hopefully eventually we'll have enough people in the community who are vaccinated against the coronavirus so that it no longer poses a significant threat to the people who are most vulnerable. Obviously, I would talk to your doctor about your personal situation and your concerns.
Certainly, those people must be taking so much extra care. Renee says, my church is getting ready to have our worship services outside, and I have not seen anything from the CDC about being unmasked while singing outdoors in Massachusetts. I know that vaccinated people can now be unmasked outside. So what's the answer for Renee?
Yeah, so I would say if you're fully vaccinated, then it should be fine for you to sing outdoors without masks on. What I worry about are the unvaccinated people who really, in that situation, should keep their masks on and keep their distance from other people.
Avi says COVID mortality is still in 2 digits most days. Does this mean there's still no good treatment regime to fully cure severely ill patients? And when will the state start collecting data about breakthrough cases and their demographics?
You know, yes, we have better treatments now than we did over a year ago, but unfortunately there are still people who are going to die from this disease. Plus, there's always a lag between the number of cases and the number of deaths. So as cases continue to trend downward, so will deaths, but that might be delayed for weeks to months. The state actually does track breakthrough cases. As of April 27th, they had identified almost 1,800 fully vaccinated people who then subsequently tested positive for the coronavirus. But that is 0.1% of the total number of fully immunized people here in Massachusetts.
And then Wendy wants to know, with warmer weather coming and the coronavirus numbers going down, should I wait until the fall to get vaccinated?
No, don't delay. Get vaccinated now. And that's because even though numbers are falling, and we are in the summer, the virus is still out there, and it's still making people really sick. And it would be such a shame for you to postpone your vaccine and then get infected with the coronavirus over the next few months.
I'm sure so many people are just desperately trying to avoid getting it at this point, what feels like the 11th hour. Dr. Mallika Marshall, thank you so much. Right. And Dr. Mallika offers her best advice, but as always, consult your personal doctor before you make any decisions about your health. If you do have a question for Dr. Mallika, though, here are the 3 ways to reach her. Email drmallika@cbs.com, on Twitter @Mallika Marshall, or you can Facebook message her, Dr. Mallika Marshall.